Hello, it's Kevin here. Again, time for a video. I haven't done one since last week, don't know, Friday, Thursday. Weekends, I'm usually out, I'm not available. However, first things first, fair use, disclaimer, so no complaints if you please. Now, here we go. So somebody sent me this, it's a nursing letter. I've got the criteria here, and I've got some samples also from the nursing to have a look at. So before we take a look at the letter in question, and I have to say I don't know where you got it from, unless it's some kind of a book, but there's a lot of detail, a lot of stuff in the case notes as I was just having a look at now. So we'll focus on the criteria first, and then we will see. So just let me get my pencil out. Pencil. Okay. So the criteria for the doctors, nurses, whoever, basically it's the same. So for a B, we need 255555. Okay, that's what we need for that. So I always say, try and get that purpose clear right from the start. Dear reader, I want you to do something for me, and then explain what it is. So if we take a look at this, thanks for accepting Mr. Dunbar into your care, regular monitoring with diabetes, and then you're supposed to repeat the request at the bottom. This doesn't really do so. Thank you for your continued, the management. So that's not too bad. This one here, introduce. This is to introduce him. So purpose at the bottom. Greatly appreciate. Okay, that's pretty clear. Ready for discharge back into your care, and he will need ongoing monitoring of his diet. So I don't know why they actually put these examples. These aren't bad, but according to the criteria they could be clearer, but we will see how it goes. So first things first, is it quick and precise? Well, let's have a look. So here we go. Right, so first things first, this is a little bit short. It's only 173 words. Now this is, they don't usually count that because that's pretty standard. That's like a memorized if you have any queries. So the name and address, the RE line, the name and the date, So it's only 173 words. It's a little bit short. Now the reason why they say 180 is that they consider if you write less than 180 words, it's not enough to properly assess you. So that's why. So you want to be aiming for 200-ish, 200, 5, 10, 15, 20, 30. Just so that it doesn't go too far over, but 173 is a little bit low. Now, home visit must visit a diabetic patient. Well, you can say patient, but it's obvious that she's a patient, so you don't need to say that, really. So you've got the name and age. You can put the DOB there if you want, or you can put, age here, home visit, Mrs. blah blah blah, aged, etc., etc. You could do it. There. So she needs some instruction how to monitor herself and how to administer insulin injection. Now I think the husband is not clear on how that works, so he wants it. Let's have a look. So home visit. So we want somebody to go to this person's home and give them some instructions how to monitor, how to administer insulin. The husband wants a home visit because he's not sure. He's the primary caregiver. I seem to remember. Let's have a look. These aren't notes. Just look at all this detail. What is it? So lives with the husband. Yeah, that's it. Husband, primary care. So all this other stuff about the family, irrelevant. The husband's the only one there, primary care. Then you've got all this stuff about she doesn't exercise and basically eats a load of rubbish. So that's why she needs some assistance there. Now, we don't really need, there's quite a lot of stuff about appendicitis and the operation which we don't really need. Not as such, because, I say, you want the reader, me in this case, to organise a visit by a nurse from my agency to this person. So all I want to know is why. And that's basically it. I'm not interested in anything else, not as such. I mean, you can give me some very general information, but I don't really need a lot of detail. What you want me to do, go to see this patient, explain, okay, this is how you do this, and this is how you do that. Okay, that's it really, yeah. And look at all this detail, quite a lot of irrelevant information there. So, right. Home visits, Mrs. Murphy requires instructions. Well, yeah, but husband assets, but we can leave that. Now, was admitted to our hospital as opposed to somebody else's hospital. Complaint of pain at that time. Right. We could either eliminate this or simply say, on the 18th, Mrs. Murphy was admitted for an appendectomy and is ready for discharge, blah, blah, blah. And that's it. So we could get rid of that. We don't need that. Why do I need that? You want me to send a nurse to this person's house. So does it matter at that time as opposed with a different time? What does that even mean? So she was admitted with a complaint of pain, which was diagnosed as acute appendicitis. She was prescribed. So we don't need this. You could simply say something. So it's like 6 weeks. So I'm not so good at math. So sometime in the 7th month, the 12th at 7th or whatever. I'm not good at maths. This is Brahmamerti. Oh, just like something. She's being discharged today following a and then we don't even need that, right? Boom. That's it. I don't, that's basically it. That's all. But if we do that, we're losing a fair bit of word count. Now let's have a look. 127. But as you see, that's essentially, it's irrelevant. You could simply do that. And that tells me all that I need. So she's, I don't need to know when she went in. I don't need to know what happened after 6 weeks, So she's being writing to request home visit for this patient, requires instructions. She's being discharged today following or after a successful appendectomy. And that's it. So, has a history of hypertension, 2014, type 2 diabetes, 2010. She has had a difficulty. She has had difficulty in compliance with her meds and regimes. Therefore, she was advised on the. Well, she's right. So, this paragraph should be a lot more in this paragraph, right? So that purpose, okay, home care visit, successful operation, we don't need that, but where's the rest of it? So she's at hypertension, diabetes, difficulty in compliance. You could maybe say what that means. Why? What is she doing? Because I might need this, as a nurse, to, she was advised on a low-fat diet, or how to take, or tools what to take, due to controlling of a blood. So, and this doesn't really work either. She's had difficulty in compliance and diet regimes, and has been advised, or was advised. I just make it has been, make it present perfect. Has been advised to follow a low-fat diet, to to control her blood glucose levels and to lose weight, or simply and lose weight. Mr. Murphy was informed to report any signs of intense pain and high-grade fever. Follow-up and a follow-up visit will be arranged. Well, again, what's that got to do with me? So, I mean, right, if we go back to it, okay, let's just go through this again. Appendicitis, just tell me she had an appendectomy. That's basically it, because I don't need that. What's that got to do with what you want me to do? So, primary care altogether. So, now, you could have mentioned something about the anxiety, and this might explain the home kind of visit. Yeah, you know, so you're constructing this story. So you want me to send a nurse to this person's house. So some of this background I might need, or it might be useful when hello, I am a nurse, when I'm knocking at the patient's door. I might need this, right, to help me to understand what I should do, how I should act with this patient, all right? So the husband is the primary care giver. So she's scared of being in hospital, anxiety, so presumably she doesn't want to go back. So, you know, she'd have to think about this, you know, oh, but, you know, I can assure you that you can do this. You'd have to, you know, maybe I might need this when I'm dealing with this patient, yeah? Sedentary lifestyle, I'm not being asked to comment on that. But of course, while I'm there, I might want to know this, so I could maybe say something to like her about, you really should, you know. So you could maybe think about this. It doesn't specifically tell you this, but you have to think, you know, what is the situation here? What's the story? What is going on? Because all this stuff here, it's irrelevant. What's all this? And all this. We don't really need this, do we? What's, you know? I don't need all this. She could ambulate, independent, with activities of daily kind of living. Okay, so again, do I really need all this stuff? So, discharge, right, so advice to lose weight. Now, patient, right, you see now we're coming to it. So, what I just kind of said there, because I'm just going through these like notes in order, right? So, anxiety, she doesn't want to go back into hospital. Doesn't cook, so she needs some advice. You can maybe put something there. So, I know it only says instructions on this, but you could maybe say something like, please note, the patient needs blah, 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 the discharge plan. So you could maybe tell me something about this. So when I send a nurse, they might be more, you know, in tune with the situation. And that would not be irrelevant as such. Because don't forget, I'm sending a nurse to this person's house. Yeah? So I know it says this, but you could maybe say, please note, the patient, apart from this, she might need some advice about this. I am advising it, you know. So you could have maybe put something in about that, but we certainly didn't really need that about the operation. Really, do it? I mean, I'd have to know why she went there. Sorry. Back up to the top. But you could just do it like that. You know? So you could maybe put something in this paragraph here. So, right? So I would put this as paragraph 2, right? It's history. So we've got the purpose. I want you to do blah, blah, blah. Okay, tell me why. What is the story? So I would probably, history paragraph 2. All right, get rid of that. Get rid of that. So what you are doing is you're constructing a narrative. You're telling the reader, me, why I should send a nurse and what that nurse should be aware of. All right, so I do that purpose. I'm writing to rubrics of request. Then fill me in. What's the story? What's the background? Right. So hypertension, type 2 diabetes, but put some detail in here that's going to help me to send a nurse, or will help the nurse who I send. Yeah. So what kind of foods? And then Mr. Brown Murphy has been informed, wasn't informed. Any signs of intense pain? And you've got this here. Okay, so this, you could put something about for which she will require assistance as she is that, hang on, let me put the changes back on, because this isn't really constructing a narrative, really, is it? That's a chat about for which she will need instruction, a demonstration. She will need I hope you see the point. I'm not gonna type out everything, but I'm just gonna give you some ideas about what you could do, right? Because look, this word count way too low, right? If we take that out, which we don't need, we could simply do it like that. You're under. We need some information here. We need some content. So request. History paragraph. Okay, what's the situation? What's the background? What's the story? Tell me something. What does that mean? Such as what, right? So she's got lifestyle. Due to her lifestyle issues, blah blah. Give the reader something. What does that mean? You don't have to go into details as she eats cakes and chips and burgers, but give me something. Due to her lifestyle or something, or due to her hectic lifestyle or sedentary lifestyle and inadequate unhealthy diet, she give me something there. All right, then I would put something here, and we need that purpose restating, right? Because what's it say here, right? Clearly expanded on later, often near the end of the document. Right, so I want you to do this. Tell me a story. Clearly expand on it. Expansion. Tell me, what's the story? Right? What do I need? What's the story? Tell me that story. And then tell me later. Right? Often at the end. In view of the above, I would appreciate it if you could send a nurse to demonstrate, who will do this, inform. That's what this letter would benefit by, I think. Okay, so again, purpose good, history. Okay, put a bit more in there. I need some detail, need a bit of content. Okay, and then if you wanted, please note the management plan is blah 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 blah. So you could give, she could include it. It's not irrelevant. Because I'm going to see, I'm sending a nurse to see this patient. So you can say, please note the management plan is, or something, okay? So, I hope that helps a little. I don't have the time to write this all out myself, but I hope this gives you some ideas. So, purpose, okay. History paragraph, put some more content. Explain what's going on. Construct that narrative. I want to know. So, the best way, as I have said, to think about this is put yourself into the shoes of the reader, right? And think, if I were receiving this, because this is not entirely clear, it's clear, but there's a lot of detail here. There's a lot of stuff which, if I were this person, I would be asking questions. I would say, well, can you tell me more? I mean, what exactly? What is wrong with a diet? Is she a fatty? I mean, what's a BMI? What's a weight? Have you told me? You haven't told me what a BMI is. You haven't told me what's going on about a diet. Anything I should keep an eye out for? there's a lot of content that's just not there. Yeah, content. What, I need some more information there. I need a bit of details, and that's way too short. It's way too short, isn't it? Short. Writing's not too bad. Organization certainly needs some work. The language features are pretty good, but it's like, put some content in, right? Organize it in a logical way. If you can do that, the author of this, I can't remember who, should be fine. But there's not enough content. It's too short. If you take out that, you've got 127 words. Even if you keep that in, there's 173 words. And there's a lot of stuff that is missing. I mean, just look at all these notes. I say, you don't need all this stuff, but we need kind of something to fill in that story. What's the background? Why do you want me to send a nurse? What's the reason? Why can't she do this herself? What's the problems? What do I need to think about when sending, or if I go there? Yeah. So, hope that helps, and see you next time.